My name's Leslie Hewitt and I'm part of the obstetric and gynaecology research team here at Sunderland Royal Hospital. There are 6 midwives, 2 nurses and 1 clerical assistant in our team. My background is in nursing and I worked in the paediatric unit before becoming a clinical midwife. I've been part of the research team now for 3 years and part of my role is to identify and recruit participants to clinical trials and monitor their progress throughout. The reason I joined the team was to make a difference for mothers and babies.
Hi, my name's Deb Bonney. I'm also a part of the obstetric and gynaecology research team. My background is clinical midwife for 9 years and I've been part of the team for a year. The reason I joined research is because I would like to help improve the future of mums and babies by providing evidence-based care. Here at Sunderland we have been recognised as top recruiters in the UK for the folic acid and the salvo trial.
My name is Stephen Hogg. I had a stroke in April 2005, aged 47. About 4 o'clock in the morning, my wife heard a bang, thinking that it was my daughter getting ready for a job. Came upstairs, but found me crumpled up in bed. I was crumpled up, but I could speak at that point. The paramedics came and carted me off to hospital. I stopped speaking by then. I was taken to Sunderland Royal, where the doctors confirmed that I had a stroke. There was a clot on my brain which was busted by the doctors because they'd had enough time to do it. I was asleep for 3 days, and when I came out again, I sure enough couldn't walk and couldn't talk. When I was in hospital, Professor Gray approached me to ask if I would be involved in research, which I agreed to. I've been involved in quite a few research projects: blood pressure pills or placebo, Botox injections, a watch to remind you to move your limbs when possible, the Ratools project, for which I was on the television. It makes part of the arm or leg go down, so they only inject the Botox on the upper or lower part of the arm or leg.
Right, I see.
When it was at its worst, it was about 15 injections in the arm and leg and 1 in the foot. For 1 day of pain, it was 3 months of relief. To take part in the research, sometimes, such as the Botox, was excellent. Sometimes, as far as the watch was concerned, it was a waste of time. But it might have been a waste of time for me, but it helps other people all the time. People need to be involved in research for two reasons. One, it might do you good. Two, if it doesn't, it'll do someone good in the long run.